Well, thank you. And hi, everybody. I'm very happy to work with the Eden network and represent the Finnish consortium of FinOMOP centers. I will share a couple of slides. No. Here. You can.
Yeah, we can see it.
Yeah. Okay, fine. So in Finland, we have 5 university hospitals and 5 medical schools. They are Helsinki, Turku, Tampere, Kuopio, and Oulu. And all of them are members of the FinOMOP consortium. In addition to that, we also have the Finnish Institute of Health and Welfare, we call it THL, that has certain registries, health registries that cover the whole nation. All the university hospitals have been paperless at least for 10 years, maybe a little more than that already. And we have an access to electronic healthcare records. And here you can see the population, the number of people that we cover. And already Helsinki, Tampere, and Turku, we cover already almost 70% of the whole population. So Finland is much more densely populated in the south than in the north. Then in the beginning of this year, we had a healthcare reform so that we have now access already also to the primary and social care data. But that's only in theory at the moment, since the IT systems are now built so that within a couple of years in practice, we are able to get the data from the primary healthcare as well. But according to the new legislation, we have only one patient registry in the region. So this is going to be something that we are able to do within a couple of years. But now we are talking about, when we are talking about FinOMOP data, we are talking about special care data. So hospital data, in and out patient visits, both are included. The only way to look at the primary healthcare data is the THL registries. So they have already registries since 2011 from the public primary care and also private and occupational care since 2020. They also have registry on the hospital care. So we have two different sources to put together the special care data. And now if we look at the FinOMOP common data model statuses in different places, in different hospitals and at THL. So Helsinki and Turku are the ones who are most advanced. They cover all the patient group and those are updated regularly. In Tampere, we are aiming to the same status by the end of this year, but now we have only a fixed cohort of all cancer patients that have been treated in Tampere region since 2007, if I remember correctly. And on top of that, we have built the FinOMOP database at the moment, but the second version should be ready by the end of the year. So Kuopio, one of those more eastern part of Finland, more north and eastern part of Finland, University Hospital, they have now plans to make their FinOMOP database during the 2024. But not yet, they are not yet there, but plans are in place. Oulu is the a little bit behind of us. There we don't know when the mapping will start. Basically, they have committed to the same procedures and same ways to do the mappings, but when does it happen? We don't know yet. And for THL, the data that they have been translating into OMOP format is the secondary care data. So visits in the hospital, in and outpatient visits, not yet the primary care, but hopefully that is also coming soon. And if we look at the OMOP codes, we have in Finland national coding systems that we are using, all the hospitals are forced to use. So in a way, it's a little bit easier for us to do the nationwide coding. We are using already ICD-10 codes, which have been translated to SNOMED CT. ATC codes are also rather easy to map to RX norm. But then the lab codes are national, but the same codes are used in every hospital, and those we have mapped to LOINC. And then we have diagnostic and therapeutic procedure codes. We are using nomenclature called NOMESCO that I think at least have been the same in Nordic countries, but lately I guess it has been specialized in different countries in a different way. But anyway, that is also nationwide for us, and we have been using ODSI tools to do the lab code mapping and the procedure code mapping into SNOMED CT. VNR codes are Nordic coding system as well. It's for the drugs, the brand name, active ingredients, strength of the medicine, package size, and this has been done in one research project, almost completely for mapped to RX norm. So this is something that we can also benefit from in different hospitals. Pathology diagnosis, we use morphology and topography codes, and that is now that is what we are working now to translate that into SNOMED CT, but it's not done completely. Then a little bit about the history of FinOMOP. Well, we started completely as a research project. So there seems to be several groups that were looking for tools how to manage and analyze longitudinal patient data. And then we run into ODSI tools and through that also Eden network, and start to keep regular meetings since 2020. And work together from the beginning. So we will share. Basically, we will share everything between us. And this group has been growing ever since. And we, in our face-to-face meetings, there has been almost 50 people attending. The structure, organizational structure, is that we have now founded a steering group for administration issues. I will talk about that a little bit later. We have a group for mapping, where we share all our protocols and vocabularies, and all of us have committed to the idea that we have only one nationwide OMOP version in place. That is actually a very active group, and I see that there are some people from that group also in this meeting as well. The OMOP databases have been in different hospitals. They have been built basically by Productivity Leap, one of the SMEs that has been trained by Eden. That is also happening in Tampere. We have analysis group where we think about the reports and the outcomes of our federated studies. And now we are running the first research project for the Finnish medicinal agency in 3 different therapeutic areas. And I think that is the first federated analysis that have been done using several OMOP databases in Finland. So there are many things that we are now learning through this research project. And this Then the FinOMOP administration, so the steering group has an idea that we should keep the administration as simple as possible so that we can really react quickly, even though there are several centers and several university hospitals, and work as efficiently as possible together. We have we jointly own a co-op called FinBB. And our idea has been from the beginning that we will have FinBB as a one-stop shop for all federated OMOP studies in Finland. So if you want to collaborate with the Finnish OMOP centers, you don't have to contact them all and make agreement with all of those centers, but FinBB can represent all of us and sign the agreement and be the negotiating partner for you. They are offering all kind of services already for the biobanks. For example, they have this financial process and procedures in place already for biobanks. So our idea has been that also the OMOP studies can be run and represented through FinBB. I think we all in the steering group agreed already that FinBB would be the one who will represent us. But now there are many details that we have to negotiate, what kind of agreements they can sign for us, and many details has to be thought through before this is completely in action or operational. Then the other thing that we have talked a lot is the permission policy. You may know that we have a brand new act on secondary use of patient data in Finland, and it's new, and in many ways a modern legislation. But when this act has been written, federated studies were not thought about at all. So there are some missing parts how to make these permission policies for the federated studies. So we have been negotiating with several stakeholders here, and we all agree that this can be done, but how heavy the processes are, that is something that we are negotiating now. So of course we would like to have them very fast and simple once again, but how can we do that? That's still under negotiation. Then we have been through this first study, which we are doing for Finnish Medicinal Agency. We are now practicing how to work together, how our roles, our procedures, how we look at the quality control, how we communicate with the client, how we manage the projects, how we keep the processes as transparent as possible, and there is many things that we are now actively working on. And then of course we have to think about the funding. So our host organizations, they have to commit to certain funding so that we can keep the OMOP databases alive and develop them further. There we are actually now. These are the active partners or core teams in FinOMOP. So this is the Tampere University Hospital, Turku University Hospital, Helsinki University Hospital, and Kuopio, which is now about to start. And then in our meetings, there are also the SMEs that are the Finnish SMEs that are trained for this OMOP collaboration. They are also taking part in our meetings. This is the THL, Finnish Institute of Health and Welfare, having many useful registries there, and FinGen is one of the large studies that we are now running in Finland, and they are one partner of this FinOMOP consortium as well. Well, this is rather shortly about the FinOMOP, and I'm happy to answer your questions. Thank you.